Would you say that the mistakes that have been made are preparing us for being able to better leverage AI during a possible future pandemic?
Whew. Let me list mistakes. So, because let's start there. I think on the surveillance front and the resource allocation front, no doubt we're going to do better the next time around, and more of these technologies will be deployed and used properly. I think public health officials, starting at the very top, CDC on down to state departments and so on. First of all, these guys, it was a heroic effort. And I think it was a very, very challenging thing, and they've received a ton of criticism, and not all of it's fair. Some of it was some of it was a challenge that no one would have succeeded perfectly at. So I want to acknowledge that up front. I think that on those fronts around resource allocation and surveillance, we'll do better. There's another major cross current in U.S. society right now, which is around racial equality. And this is also a critical learning period in how machine learning can help there. And at our company, we had a discussion this morning about the role of race in algorithms, and how they can, if they're not designed carefully, thoughtfully, and tested carefully and thoughtfully, they can exacerbate the effects that are seen in the data. So we have to be extremely mindful of biases in data, and then how these algorithms are delivered, and make sure that they're not contributing to inequality of care delivery and other factors. So that's another interesting frontier that's very active right now that we're also thinking about carefully.
But without AI, we would definitely be worse off.
I think so. I think so. I think that it's kind of funny with technology adoption and society in general. The technology comes along at a time when you need it to confront ever more complex problems, and this is where we are with medical data. So, an interesting observation in the U.S. We only have all this medical data because the High-Tech Act about 10 years ago incentivized widespread EMR adoption. So now that we have all this data, we're expected to use it well for surveillance and resource allocation and so on. And it's only now that the computing power and approaches and data science techniques have matured enough to make use of all that data. So you see one technology empowering another. And I think now that we have all that data to use it effectively, we do need machine learning. It's just impossible to do without these types of approaches.